Hey, good afternoon. This is Mary Hoban with the American College Health Association. Thank you all for joining us this afternoon. I apologize, we're getting started a few minutes late due to some technical glitches that didn't come up during our practice session, but that's technology for you. So we're, I think, ready to roll here and have some great information to share with you. Before we get into kind of the nuts and bolts of what we're going to talk about today, I want to point out to you there's some tips on your screen that we've put together. They're common questions that come up during webinar sessions with GoToWebinar in case you're not used to using this software. But you'll see there's some tips on the slide, and this information is actually pinned in your control panel under handouts. You'll notice there's a tab for handouts. There's one thing there right now, and that's a copy of this slide. So if you get into a jam with the audio or video, we'll ask you to kind of refer there. Also notice that you have access to a chat box, and in that box you can pose a question. We have folks that are kind of looking for two things, looking for questions around technical problems, and we'll go ahead and get those answered. We also would appreciate your comments and questions throughout the presentation. We'll allow some time at the end to address those. So as you think of them, please go ahead and make a note of them in your chat box, or I'm sorry, in your questions box. And we'll be monitoring those throughout. We will also, we're recording this session, so it will be available at a later point if you'd like to share it with others, and we'll also make the handouts available at that time as well. They're not available right now because we're still editing them a few minutes ago, but we're ready to go, and we'll make that available to you. So again, my name is Mary Hoban. I'm the Chief Research Officer here at the American College Health Association. And I'd like to ask each of my co-presenters here to take a second and just briefly introduce themselves before we get to their section in the presentation. And I'd like to thank those folks that have joined us here today. I've had the good fortune of working with this group over the last, gosh, almost year and a half now. And I recall when I got that call from Maren Greathouse at the Tyler Clementi Center at Rutgers saying, hey, what do you think about getting together all these national surveys and really kind of looking to see what we can learn about queer spectrum students and trans spectrum students? The data geek in me got very excited. This is it's one of the favorite projects that I'm working on because it is definitely a data crunching investigative thing, and it brings out that side of me. I enjoy working with it, but I've got to meet some great people at these other organizations that are also doing some really incredible work around making college campuses safer for all students, and I'm anxious to share that with you. So let me, without further ado, let me ask Allison, who's with us from NESE, to say hello.
Hi, my name is Allison BrckaLorenz. I'm a research scientist and project manager at the Center for Postsecondary Research, where we are best known for our survey, the National Survey of Student Engagement. And I'm also very excited about this project as it fits perfectly into my own research interests.
Thanks, Allison. Maren, you want to say hi?
Hi, I'm Maren Greathouse. I'm the director of the Tyler Clementi Center at Rutgers University on the New Brunswick campus. And I'll just add that I have been so honored to work with such a team of brilliant, competent, and researchers who are open to new and innovative projects.
Thanks, Maren. Ron?
Hi, Ron Huesman. Got a couple different roles. I'm a Director of Institutional Research at the University of Minnesota, and I'm also the SERU Principal Researcher, which is Student Experience in the Research University Consortium, which is a partnership between the Centers for Studies of Higher Ed at Berkeley and Minnesota. And again, it's been my honor to be a part of this group. I'm humbled.
Thanks, Ron. Sue?
Good afternoon, everyone. Sue Rankin, formerly at Penn State, retired, and now just doing research and having fun and working with these fabulous folks.
Thank you, Sue. And last but not least, we've got Ellen.
Hi, everybody. My name is Ellen Stolzenberg. I'm the Assistant Director for Research at HARI, the Higher Education Research Institute, which is in the UCLA Graduate School of Education and Information Studies. I will second, third, and fourth all of what everyone else said. It's been a real honor working with this group of folks. And for Maren, thank you for, we're like herding cats sometimes, so we're all the time. So getting us all together and having us all share what we've already been doing, but in a much greater forum.
Great, thanks, Ellen. So Maren, I believe you're up next.
All right. Well, so like I said, my name is Maren Greathouse, and I oversee the Tyler Clementi Center here at Rutgers. But to give you a little bit of background about the center, it's primarily a research institute that examines the impact of bias, peer aggression, and campus climate among students holding historically marginalized or stigmatized identities on college campuses. So last year, the marquee study that we convened is the one that we are going to be talking about today. And it still blows my mind that we were able to get such an incredible, team of people together from all of these, major research institutes to collaborate on, an analysis of these populations across 7 different large data sets. And you can hit slide now, Mary. Hooray. And so for those of you who don't know the history of large-scale studies on student experience, most survey research centers, with rare exceptions like the American College Health Association, have not included demographic variables for sexual orientation and gender identity until quite recently. As you can see on this slide, the addition of these variables has been staggered across the last 10 years on the surveys that were part of our study. And there are many surveys that still don't include those. And so when we convened this study, there could not have been a more perfect time, because it was really the first time that all of these, entities began to include these demographics. So we couldn't have done this 10 years ago. We couldn't even have done this 5 years ago, including all of the, data sets that are included here. So this is very, very, very exciting. Do you want to hit the next slide, Mary? So I wanted to talk about that first, because the significance of this study is pretty, it has a lot of gravity to me. Because prior to the revision of these instruments, queer spectrum and trans spectrum students were virtually erased from the data collection on college student experiences, some for as long as 40 to 50 years. And when you don't show up in the data, you don't show up in the discussions that are, held by institutional planners and chief executives at your institution. You're invisibilized. And so there hadn't been for quite a long time any inquiry into the experiences, interests, and needs of these populations, with the exception of studies that were done on an individual research level or among individual research teams, and it required a great deal of effort in terms of, getting funding for studies, trying to manage the methodological challenges of using convenience samples, having a lack of generalizability, which, although it's not a bad thing, it's not an ideal challenge when you're trying to influence policy. So that being said, this project has been pretty exciting. And not only were our 4 national research centers on board to collaborate, and the expertise of Dr. Rankin on board, to really shape this project, but the most significant, I think, the most significant aspect of this study is that we were able to look at a sample size that surpasses any work that's been done independently, capturing, roughly 70,000 students. And these weren't convenient samples. In convenient samples, the data can be skewed towards, out students who are connected to resource providers, who are open and comfortable enough with their identity to participate in a survey. But these were surveys that were blanketed across college campuses. And so we were able to get possibly the responses of students who might not take a survey that's targeting LGBTQ students, but a general survey that's offered to the entire campus. So that there's an additional aspect of this that was really exciting. And so we have findings from 918 colleges and universities. And looking at the Carnegie classifications, we had a little more private schools than publics. We had almost 200 doctoral institutions, almost 400 master's level institutions. We had 2 tribal institutions, some special interest populations around tech, institutions around tech or arts and sciences. And so it was a really good mix of, institutions across all different Carnegie classifications. And it goes without saying that, that the timeliness of this study could not come sooner, especially considering the current administration, continuing to strip these demographic variables from all kinds of federal surveys. And so I am so honored and thrilled that we've been able to put this together. And so does anyone want to share at all anything else about the significance from your vantage point?
No, I think everybody's muted, Maren. I think we can just proceed.
All right. Well, so I'm going to hand it over to everyone else to talk about the variables and how we were able to collapse them in order to do this analysis.
Okay, this first slide talks about how each instrument measured sexual orientation, and I think each group's just going to take a minute and talk a little bit about what they did. So Ellen,
Hi.
You're up.
Yes. Hi. So for SERP, which is the Cooperative Institutional Research Program, which is the survey arm of HARRY, so that includes the freshman survey, which is what we're probably most well known for. We decided to add these questions, and we started with sexual orientation before gender identity. And so we asked, what is your sexual orientation? And these are the options at the time that we did this study. So heterosexual, straight, gay, lesbian, bisexual, queer, and other. And these have since been modified, which we'll talk a little bit about later. But those are the options for our surveys, which we have surveys that are both done on paper and web. Okay. Ron?
Yep. For the SERU, this is the option we had back in 2016. And again, these have evolved over the last couple of years as well, and in part due to the work we've been doing with this group. But we, for the analysis, we did the heterosexual straight as one category. Then we collapsed the following categories into a spectrum of queer spectrum category for gay or lesbian, bisexual, queer, questioning, and other. And we've been asking these items, sexual orientation and gender identity, since about 2010 when the project started. So we've got quite a long history of collecting this information, but not much history of actually using the information until recently.
For the NESI question, we started piloting in about 2012, and we've undergone some changes. This is currently, though, what our since 2017, what our question has looked like. And I've done a lot of work with those write-ins. And I think Mary's probably going to talk about what happened with asexual and how we ended up treating that in our study. But that was something, that we would have captured in one of our write-ins. And we'll talk about some of our specific challenges with this item in a couple slides.
Hi, this is Mary Hoban again. You may have noticed a couple of slides ago that the date that was listed for NCHA when we began collecting data around sexual orientation and gender identity was 2008. Truth be told, the survey initiated in 2000, and we did have a question then. That question, though, was rather immature, and in hindsight, really not a good question. It made sense at the time, and before I tell you what that question was, I want you to please remember that was 20 years ago, and we've all learned a lot in 20 years, but that original question was one question that asked students, which of the following best describes you? And they could choose from heterosexual, gay or lesbian, bisexual, transgendered, or unsure. So it was one variable that, or one question that confused a couple of different concepts. There was not a terrific question. I feel like I want to say, like, I hope we get some credit for trying. It was at a time when nobody was asking these questions, and we knew it was important. We missed the mark, though, in how we did it. So those questions that we're currently using really kind of separated and became two separate questions in 2008. And what you see on the screen here is the question used in the data that we're analyzing for today's presentation. And this one is the sexual orientation question, asks students to describe their sexual orientation. And you see all the options listed there. We made some mistakes with this question, and one of them being that we listed everything in alphabetical order. So asexual was first, and we got a surprisingly large number of students indicating asexual. And because we're concerned about instrumentation bias with that, we've omitted those students from this particular analysis. We're asking the question a little differently now. We've learned a lot about that, and in later data sets we'll be able to analyze to better understand the asexual students. But for this particular study that we're looking at, we collapsed bisexual, gay, lesbian, pansexual, queer, questioning, and same gender loving into a queer spectrum variable. Now I'm going to move over to the gender identity questions.
So for SERP, we started asking the question, do you identify as transgender, yes or no? And we, again, having learned a lot, it is now a two-part question. But at the time, this was what we had. Do you identify as transgender, yes or no? So for the purposes of the SERP data, we don't talk about transgender and cisgender. We talk about transgender and not transgender, because the people who said no, we can't assume that they identify as cisgender. So that's why for our purposes, and when I talk about some of our findings a little bit later, you'll see transgender and not transgender. It's not the easiest thing to say, but it's accurate in terms of the data we were collecting at the time.
And on the SERU, we are using that two-part question, and a lot of the labels that we were using in 2016, we've changed now. So indications of male and female with sexual type labels have been removed, and now we're using men and women, and we separate trans men and trans women as well in the newer versions of the survey. One of the questions we've struggled with is, in the two-part question, is what to do with people that indicate a particular sex at birth that corresponds with the gender identity they're transforming to. Is that measurement error? We're not really sure how to deal with that. So it's one of our issues that we have, a question we have.
We in NESI had a lot of trouble coming up with what we wanted for a gender identity question, and ultimately ended up with something that seems a little simple but does rely on people to give their own specific identification through a write-in, which then turns out to be difficult to analyze. But again, that was just our way of trying to honor all the different ways that people might identify and still write a pretty useful survey question.
With the NCHA, what you'll see here is that we actually ask 3 different questions. We ask about their sex assigned at birth. We ask whether or not they identify as transgender, and then we ask them to how do they describe their gender identity. And we've written a program that takes the responses to all 3 questions to sort student cases into either female, male, non-binary, or missing. So anyone that doesn't answer all 3 questions, we recode as missing and are not part of the analysis that we're talking about today. If they indicate that they're transgender, or if they don't identify as transgender, but their birth sex is different than their gender identity, then we categorize them as non-binary. And I should explain that the original responses are all still in the data file. One could make a different decision about how to analyze our data, and that's still possible. We just made this new variable for the sake of our ease in presenting results. We too have learned, I don't know that there's another area I work in that's changing more rapidly than understanding gender identity. And we have gone through several different transitions with this. We're getting ready to pilot test the NCHA 3 survey, and on that one, the sex assigned at birth, first of all, removes the part about on an original birth certificate, and it adds intersex as an option. The other thing is in the write-in part, we learned a lot in the write-in part, another identity please specify under gender identity, and we've added a couple more categories there: agender, non-binary, gender fluid, and intersex. And we will see how that plays out in the pilot before we make a final decision about how we'll proceed with the NCHA 3. Though my sense is that no matter how we proceed, it's something that may look different in another couple of years too, that it really is a rapidly changing field. So from here, we're going to move into some of the challenges each organization had in adding these questions. And we'll start with Ellen from HERE first.
Okay, so I mentioned briefly that we, some of our surveys still have paper-based administration in addition to web administration. For example, our freshman survey, which is administered at a few hundred campuses every year, about 60% of the institutions still use paper. So we have what we call a real estate issue when we're trying to design questions. And so that's one issue that we run into. We had a significant turning point after the 50th administration of the freshman survey, which was in 2015. We had some new leadership and people who wanted to start asking these questions. So we didn't have as much push and pull amongst the stakeholders as some of the other groups did in terms of adding section and gender identity questions. One thing we do struggle with, as you've heard from everybody, is how do we accurately capture these concepts and these really important aspects of identity. The data is useful and usable. So we constantly struggle with that. We have a national mission for the Institute, but we also work with individual campuses. So we have to make sure that the data is useful for the campuses when they get their data back. And so again, there's multiple levels of some of these decisions that that we have to make. And one of the big ones for me personally is standing our ground, which I wrote standing our ground here, which is we have lots of schools, faith-based schools in particular, who ask us to take these questions off the survey, and we say no. they say, well, we're not going to do the survey if you don't take that question off. Okay, don't do the survey. We are not going to change that. And so that's something that we feel very strongly about on all of our student, faculty, and staff surveys. They all have sexual orientation and gender identity questions.
All right, I'll try to be quick here. For Nessie's challenges, we had to deal a lot with talking about people's use of longitudinal data. They often use our data to sort of track trends over time. And anytime we even make the tiniest change, it often throws people's plans a little bit awry. So fortunately, we were undergoing a large overhaul of our survey in 2013. So that was sort of when I struck with this, okay, let's try to fix and get these questions added. But there was some trouble with that. We had to have a lot of conversations. We'd had, what is your sex, male and female, for 10 years or something like that. And there was this whole, well, it's mostly working. If it's not broke, why do we have to fix it? So I had to do a lot of kind of educating on the damage we were doing and asking the questions in the way that we were asking them. And some people question, like Ellen said, we always have these real estate issues. You're supposed to just ask, what's vitally important, what is going to matter. And they would say, well, how do we even know sexual orientation is going to matter? And so, I had to make these promises that if you let me ask it, I will show you that it matters. So we had to go through those kinds of conversations. I think writing the items, we've all experienced some challenges in that. Best practices are a little bit dangerous and contradictory of one another, actually. You'll get one organization that says, oh, the best way to ask it is this, and another that completely contradicts that and gives other guidance. So we had to do some compromising to choose wording and questions that works best for us and what our goals were. And I also had to promise that I would use the heck out of it. So I do code all of those write-ins and can make that available to people interested in using it just to get that data some use. We also were piloting the sexual orientation question during the time of Don't Ask, Don't Tell, and we have a lot of military institutions, so we had to come up with a mechanism that allowed institutions to opt out of asking the question. We ended up making it an opt-in question, which turned out to be problematic as we were only getting 20 to 25% of institutions adding it. But in 2017, we did make the change to make it required for everyone. And then, as Ellen said, we did have some schools that were upset about that and wanted us to remove those questions, and we did not remove them and had to say goodbye to those schools, which was sad but important.
I mentioned some of this with the SERU. I think, like Allison, it's kind of a balance between how inclusive are you going to be in the options, but still be respectful, but also try to manage the length of the survey and how much can you put on there. One of the things I've struggled with the other category, the write-in, is developing a process for getting that information out of there, and so it can be used. And I think it's been hidden in the past, and there's a lot of rich information in the other category. But it's also a place where a minority of students express their displeasure with us asking those questions. And there appears to be some relationship with political affiliation or religious affiliation that seems to impact those responses, and what to do with those. And then again, as Allison mentioned, the language choices that we use. We do lots of conflicting feedback from different resources, and how do we work through those and come up with a consistent language for the survey. And for SERU, we don't allow changes to the core items where these items reside, so every institution that participates has to use them. Up to this point, it's not been an issue for us. Our base is large research universities, AAUs, and so we'll probably have more similar characteristics and more alike in many ways, and not as varied. And then again, I mentioned earlier when we were talking about definitions, what do we do with the two-part question when alignment does not go the way that you expected? And is that just someone not paying attention, or what is that exactly?
Sorry, I need to remember to unmute myself before I start talking. I'll try to, I could say us too on just about every issue that the other three research centers have mentioned: the longitudinal concern, diverse institutions. When do you kind of make your stand and add it to as a core item? We luckily we're kind of a relatively young survey, the new kids on the block compared to some of these other instruments that we're talking about today. We didn't start using the NCHA until 2000, so there was never a question about when do we add it, is it okay to add it. We started with it, albeit in a very clumsy, not very useful way, but we never had that concern about how to do that. We have certainly felt the pain of all the other concerns that have been mentioned. You know, how do we do, what happens when we make a change, and how do we compare with earlier data? One of the biggest challenges, I think, for us has been really staying relevant and current in what's been some rapidly changing constructs. I'm trained as a sexual health educator. I teach a human sexuality class, and I'm still, every time I look at our open-ended data, I'm going to Wikipedia to learn something new. My sense from hearing from students is that they are really unhappy with our language and have taken it upon themselves to create their own language that resonates with them, and we've got to better learn and understand that language. I'm also noticing, and this is coming in the write-ins, that students are recognizing the complexity of, particularly of sexual orientation, and want to explain further differences in their romantic attraction and sexual attraction, and really dive deep into that, which is terrific, but very difficult to measure on a survey like this that has very little. The term real estate was used, and we use that as well. We have very little space to measure that. And really the biggest challenge in the last 3 years is how to best measure asexuality, since it's a term that seems to be understood differently in different communities, and we're still working at that one. So from here, we're going to move into, actually, Sue, you're going to come up and talk about some of your challenges.
I am. Hello, everyone, and thanks to my other presenters for their amazing work. And I want to start by saying to the folks who are listening, you know, they went through these things and these challenges in one slide, and I think it's crucial to recognize that these are the heroes, frankly, for me, and sheroes, based upon national research around queer and trans spectrum. Many of you know I've been doing this for about 30 years, and without these folks and their individual activism and advocacy at each of their institutions and organizations, these questions would not be asked. So it's not like, oh yeah, we're going to ask, and everybody said, yeah, sure. I know that the methods in which they had to go through in order to have this happen was not easy, and I want to make sure we recognize their contributions. So the second important piece is that we worked a long time as a community to add these questions to national surveys, and we're successful in many of them. So we could look at higher education or SAMHSA and get information about queer and trans spectrum issues in those large national surveys. But as many of you know, in one executive order, those were pretty much stripped from those national surveys over the last 2 years. So the work that's being done among these organizations is giving us information we can't get anywhere else. And I'm one of those folks who does the research, and so I'm privileged to do that work. But as Maren pointed out earlier, there's a lot of limitations to the work I can do using convenient sampling. So I just want to make sure we give credit to those folks who are on this call for the amount of work they've done to keep this at the forefront and be able to share with our campuses and administrations how we can use this information to assist our communities. So the 4 things on the slide have already been talked about, but to give you a bit of a history, in my first national queer and trans spectrum survey, there were no trans because it wasn't what we talked about back then. So it was an LGB study with lesbian, gay, bisexual, and that was it. Bisexual was actually one of the things we thought we were being really inventive by adding it in. So things have changed dramatically over the years, as they've already pointed out. But I think it's crucial that because these are national surveys that are not queer and trans spectrum focused, asking the questions the way they're asking them is crucial for us to move forward, and that those terms change on a daily basis pretty much. So in the USTS study that we just completed a year and a half ago, the United States Transgender Survey, we had over 22 response choices for gender identity, and we still had over 2,000 write-ins. So I think you can see the gender fluidity is growing and meaningful for the populations of folks that we work with. For operationalizing the items, you heard that we asked them very differently, but for our purposes in this project, we use queer spectrum and trans spectrum to collapse those categories into meaningful variables to be able to do some of the work. It's also crucial to recognize that there are lots of politics within our community. I know nobody realizes that, but there are politics in our community. So no matter what we ask, no one's going to like it, and everyone's going to have a comment or an issue about how we ask the question, which is why we ask for write-ins, and that's crucial. But I'm also about the work that I do in climate work is similar to the national studies in that it's not a queer spectrum or a trans spectrum project, it's a climate assessment. And in that work, we also have to narrow down our topics, but I've been able to ask questions around gender identity, gender expression, sex assigned at birth, as well as romantic and sexual attraction. So we get a really good idea, at least, of how folks are understanding this, and we lobby very hard with our campuses to try and make sure we include those questions. There's also the politics of race that we're not talking very much about, in that many of the categories that we are using, the variables that we choose and the names we choose to identify those variables are very much white social constructs and are not inclusive of the various racial identities that choose to do and use different terms for identifying these 2 different identities. And so I think to keep that in mind as well. So the intersections that I talk about are those that are identified in that 4th bullet. So we need to think about ourselves not only as gender and sexual beings, but also as race and spirituality and economic and all kinds of other things that impact our ability to be successful in higher ed. And that's the reason we do this work. So the next part of this presentation really is about climate on campuses, and we're giving this kind of context to allow folks to understand that the things that folks are experiencing on college campuses influence what the results are you're going to see in a few minutes. So it's a construct, so we have to ask lots of questions to get what climate is. And the definition that we use in our work is broad intentionally, because it's not just how I feel, but it's also how the institutions, policies, procedures, programs, etc., either include me or totally have me invisible, right? So how do I make sure that those are inclusive? How we measure it in our work is how you personally experience the climate from where you sit in the institution, how you feel it's for everybody else in the institution, and that we're doing or not doing to address those things at the institution. So when you look at those 3 things, we then look at, so what is climate? We can go to the next slide, Mary, thank you. We see climate as a 3-cogged wheel. And if you're an engineer or an economist, I know the 3-cogged wheels don't work, so don't point it out to me in the chat box. But it gives you an idea that climate is constantly changing. And I've offered several references at the bottom of each of the slides that I'm talking about. And you'll note that many of them might seem dated. And it's because those are seminal articles, the articles upon which we build our work. And it's, I think, crucial to make sure we recognize those that came before us and are doing the same work that we're doing. So The reason we exist in higher education is students, and this presentation is focused on students. Faculty and staff obviously are important because they help create that knowledge. And as student affairs staff, we are there to make sure that students get the best experience possible. I will tell you that in most of our studies that our marginalized student groups tell us that even though they're staying at the institution and they're being retained, that they're barely surviving the experience as compared to their majority counterparts. So we look at faculty, staff, and students currently at the institution. We don't review folks who are alumni or trustees or people like that because they don't live at the institution and have the day-to-day experience that the other folks have. So the next slide I call my V8 slide. So you measure campus climate. If you have a positive experience, if you feel it's great for everybody else, then you're successful. And for students, that outcome measures that we measure are you learning? Are you doing that in a healthy way? Are you doing 25 Red Bulls to get through the day? And your overall well-being. So are you healthy and moving toward creating a better you by being at the institution? How are we helping to do that? And those things lead to you staying at the institution, which is what administrations really want. They want you to stay. So over the last few years, we go to the next slide, climate matters. Students at 93 institutions over the last 2 years have made demands of their institutions based upon race. So race is an issue that we need to address. Sexual assault has been around since I've been in college, and that's a long time ago. But right now, women on college campuses are demanding safe spaces and require us to do that. Transgender students, LGBTQ students in higher education are demanding safe spaces, and especially in the current political context where they're being challenged on a daily basis by state legislation and federal legislation to pretty much make them non-existent. And they come to our campuses with the expectation that we'll provide a safe space for them. The next slide talks about disabilities, and in our work we've seen the number of students with disabilities go up over the last probably 10 years exponentially, mainly because of the identification of those disabilities in K through 12. And so students are being diagnosed, given the accommodations they need and or the pharmacological aid to be successful. So they're now coming to our colleges and universities expecting to have those same accommodations. And if we're right, you'll see undocumented and DACA students. And here is where political conscience is crucial. In our surveys prior to 2016, the year previous, we had over 500 identified DACA and undocumented students. Since 2016, we've had less than 10. So to say that they're not there is ridiculous, but they're now gone back to being invisible because of the fear of them coming out and what would happen if they did. International students, they're our favorite students in higher education to talk to an administrator because they are full pays. But what are we doing to support those students who are oftentimes families are looking at them to be the folks that come back and then help their families when they get back to their own countries? What are we doing to support those students on our campuses? And veterans who come back very different kids than when they left. Now, these slides are here because, again, to talk about the intersections of our identities, and that all of these identities are also made up of students who are queer and trans spectrum. And how are they navigating those multiple identities when in fact they're being challenged on those identities on a daily basis, both by federal and state legislation, and what they can do to try and what can we do as student affairs professionals to assist them in moving forward. The next slide, if you haven't met Richard Spencer, I hope you have not. He's the guy in the middle, where we've been challenged around free speech and hate speech on college campuses, and that has caused political divides on our campuses between our students. So again, now political activism and your political status also influences an identity that now is much more on the forefront than it was before. So we measure all of these things in our surveys and try and look at them and how they may challenge a student in greater ways than mono identities. So what does all mean? So what do students do in response to climates that are unwelcoming, right? What we find in our work is that students, sorry, Mary, you went too far. There's, never mind, my bad, we're doing that later on. We'll talk about later on some of the consequences of unwelcoming climates with regards to student departure and lack of persistence. But quickly, let me go through some of the summaries of findings that we've had, and these are inclusive of both my research and our climate assessment work. We've now done over 197 climate assessments across the country, including research ones, liberal arts, community colleges, et cetera. And so I just picked out 9 campuses from our 17 work and just focused on the queer and trans spectrum responses for this slide. But you can see in 03, that was my first national campus climate study on queer and trans spectrum students, faculty and staff. And you can see going across the different studies that it's kind of gotten better. But when you say it's gotten better, it still sucks, excuse me. It's still 31% of students experience harassment to our queer and trans spectrum. They still identify their campuses as homophobic, biphobic, and transphobic. And a third of them still think about leaving the institution because of how negative that climate is for their particular community. So you'll see from the subsequent findings of my colleagues that we all are finding similar kinds of things, and they'll be much more detailed about their surveys and studies and results in the following slides. So thank you very much.
Hi, Allison again for NESE. So I'm going to talk about some of the things NESE has found in this investigation of queer and trans spectrum students. First of all, we get a lot of queer spectrum students on our survey. I do want to emphasize 28,000 students about in 2017, so there's a lot of people for us to be looking at that we were kind of ignoring before. Even though it's only 5% of our total students, it's still a big chunk. I think people are often surprised with the large proportion of bisexual students in there, but we do have a lot of college students identifying as bisexual. And then a lot of these smaller groups are actually pulled from the write-ins that students are giving us. So the popular write-ins are pansexual, asexual, demisexual. I will say that queer was one of the top write-ins, but we did actually add that to the actual survey instrument, so that was a little bit of a change. But I think it's great to see all of this great variation in the different ways that people are identifying. Next, Mary, thanks. So here's some of the things that we looked at in relationship to the climate things that we measure. So a lot of interactions with other people. Queer spectrum students tend to have less positive interactions with others, particularly with other students, which is unfortunate, and administrative staff and offices. And I know that's particularly hard because a lot of these offices are there to help these students, but things still aren't going quite well. They tend to perceive less support from their institution overall. They do a lot less collaborative learning, which I think plays into having less positive interactions with other students. And contrary to what some of NESE's studies have found before, we found that queer spectrum students were doing a lot more student-faculty interaction, but we're not really seeing that as much from students now. It's about the same. For some of our academic and co-curricular outcomes, which is a little bit more what NESE specializes in, we look at sort of their behaviors in their courses and what they're doing academically. We see that queer spectrum students are doing far more reflective and integrative learning than their straight peers. They're aspiring to higher level graduate degrees, doctoral or professional degrees, which I think is great. But they are integrating in sort of group activities less often, such as becoming student athletes or members of fraternities or sororities. I thought it was a little interesting that they're less often participating in service learning activities, which when in working with some other people, some have suggested that that might be they're just not doing service activities as part of their institution, but perhaps as part of their community culturally. And they're also perceiving far fewer gains in working with other people. Again, this seems all tied into the climate and their interactions with other students. Next, thank you. Another thing that I always like to look at are what are students majoring in, what are their choices for major. And you can see here, and compared to the straight students, the queer spectrum students are far more often majoring in arts and humanities, social sciences, which I think makes a lot of sense, but they're very underrepresented in health professions and business, which I find very troubling. But I think you see a lot of business interactions in the news, and that might make sense. It's also a little troubling that they're having an issue with health professions, as we all need to consult our health professionals, but they often find those to be unwelcoming fields. And then next, talking about our trans spectrum students. Now this is quite a bit smaller group, but still pretty hardy for us. It's only about 1% of our students, but it's still quite a few of them. And what I found, remember our question has man, woman, and then a write-in for another gender identity. So these are all captured within the write-ins, but you'll notice a very large chunk of them are uncodable. And what those mean are, you know, they didn't give us something that could be coded as a gender, or they wrote something that obviously isn't a gender identity. It's some sort of joke or objection to the question. And this slice of uncodable is much smaller in our sexual orientation data. So I think that's a message that students just aren't in the same place, possibly developmentally, in talking about and thinking about gender identity. And taking that as seriously as a category. So that's a little bit of issue of concern for me. And next. So our climate outcomes semi-mirror what we saw for the sexual orientation question. Again, less positive interactions with others, particularly students, staff, and offices, perceiving less support from their institution, still less collaborative learning. Again, about the same student-faculty interaction, but far, far lower satisfaction overall. We see that quite a bit more than with our queer spectrum students. And then our academic and co-curricular outcomes, very similarly, they're doing more reflective integrative learning, aspiring to higher graduate degrees, just the same, not as often being athletes or members of kind of co-curricular sorority, fraternity, or sororities. They less often participate in service learning, but it was very interesting to see they more often have leadership experiences, which I think is great and maybe can help lead to some positive change. But similarly to the queer spectrum students, they have lower gains in working with others. Then my last little slide is again about academic major. And if I thought the queer spectrum majors were kind of disproportionate, it's particularly disproportionate for trans spectrum. We see they're far, far, far overrepresented in arts and humanities, which makes me think that's a welcoming place and good for them. But again, we have this problem in business, health professions, where it's much lower, much less likely for these students to be in those fields, which I think is very problematic.
Okay. So just briefly, I'm showing this because I wanted to show sort of the chronology of the student surveys. I'm going to be talking about the freshman survey, which is administered at college entry. And so this is basically a snapshot of who the students are when they get to our campus before they've been exposed to any courses or student activities or anything like that. So it's important because, you know, we also have follow-up surveys at the end of the first year, your first college year, campus climate for diversity in the diverse learning environments, and then we have a senior survey. Next slide, please. It's important because Alexander Aston, who's our founding director, and he created the freshman survey in 1966 at the American Council on Education. His sort of method of analysis for this type of data is what we call IEO, input, environment, outcome. And so what a lot of institutions or studies tend to focus on is the relationship between the environment and the outcome. But what Sandy always posited is that what's important is the input. Not only the input's relationship to the outcome, but the input's relationship to the environment. So who you are and what you bring with you to college puts you in certain environments within the institution that then in turn can lead to an outcome. And so that's why I'm focusing on sort of the entry characteristics of the student inputs. Next slide, please. So this is just a breakdown of this particular year's queer spectrum and trans spectrum students. We had, in this sample, we had 12,872 queer spectrum students, which is about 8.5%, and we had 675 students who identified as transgender. Next. So I wanted to focus on some of the emotional health, mental well-being items because the differences that we see are quite drastic and sad and unfortunate, and so we have to think about how we can best serve our students when they get to us, and not just what happens once they get there. And so here, what I wanted to focus on, we have 2 questions asking about the previous year, and these are traditional age students for the most part, so their last year in high school, what their experiences were with feeling depressed or feeling anxious. The options are frequently, occasionally, and not at all. And this is the proportion of students who the darker blue is frequently felt depressed, the lighter blue is frequently felt anxious. The anxiety question is relatively new. The depression question we've been asking for decades. And so what we see here is for the transgender students, we see nearly 2/3 of these students. There we go. Nearly 2/3 of these students frequently felt anxious. Nearly half frequently felt depressed their last year in high school. I mean, think about that. I mean, each campus may not have that many transgender students in their incoming class, but if you think about these students as a group and what they're bringing with them, these numbers are very, very high. We also see similar differences between the straight students and those who identify as gay, lesbian, bisexual, queer, or other. And what we see consistently in students that identify as queer, in particular, have much higher levels of anxiety and depression than those who identify as any of the other queer spectrum categories. Next slide, please. So some other questions about with this data. We have the frequently felt depressed again, frequently felt anxious, and this we have the queer spectrum as a whole, as opposed to broken down as we had in the previous slide. But I wanted to focus here on the psychological disorder. In even years, we ask about disabilities and certain illnesses and disorders, and we had nearly more than half, actually, of trans spectrum students say they're coming in with a psychological disorder, compared to 11% of the non-trans spectrum students. And for the sexual orientation, we see that more than 1/3 are coming in with a psychological disorder. Now, whether this is diagnosed or not, we don't know. But this is, you know, compared to feeling depressed and feeling anxious, this is something where they're saying, I have a disorder. Next slide, please. This is where the news gets even more grim. We ask students to rate themselves on a variety of skills and abilities compared to the average person their age. We have 5 response options: below average, lowest 10% on the low side, average, and then above average, highest 10% on the high side. Above average and highest 10% on the high end, and below average and lowest 10% on the low end. What we see for straight students is that 13.4% of them put themselves in below average or lowest 10% in terms of their self-rated emotional health. Compare that to nearly half of the queer spectrum students. Nearly half. That's a lot of people. In this sample, you know, we're talking thousands and thousands of students. And you can see the breakdown here when we disaggregate the queer spectrum by the individual response options. And again, we see that students who identify as queer are more likely to, more than half in fact, put themselves in the lowest 2 categories. And keep this in mind when we look at the next slide, please. The transgender students. We see half of all transgender students are putting themselves in the below average or lowest 10% category in emotional health compared to their peers. So again, combined with the other items that I talked about, the students are coming in with significant needs, and you know, the campuses have to be prepared and trained, and the services have to be available and accessible to all students. Next slide, please. I very briefly, I'll touch on this. This was the end of the first year survey, so there were 2,000 students, and it doesn't look like things are getting much better at the end of the first year. We see that queer spectrum students were more likely to frequently feel homesick or lonely, feel isolated from campus life. They were more likely to use psychological services, which I like to think is a good thing if the services are, as I mentioned, if they're prepared and appropriate for students who are having these needs. Next slide, please. Again, looking at some of the end of the first year findings, there were only 156 transgender students in this sample, but what we'll see here is that, again, combining frequently and occasionally, the transgender students were more likely to feel unsafe on campus, to use psychological services, and also to feel isolated from campus life. So these trends are not just at the beginning of school, but also at the first year, rather, but also at the end. Okay.
Okay. So on the SERU, we from 26, these stats from 2016, and we were 16 research universities that participated that year in the survey. And using the definitions we defined earlier, we collapsed a queer spectrum category for the analysis that represented about 11.3% of the students, so almost 9,900 students were represented there. In the other and open-ended categories, we're able to identify different groups like asexual that were not included in the analysis that follow, but they're there for completeness sake here. Next slide, please, Mary. And then again, on the trans spectrum categories, we were able to identify 1.7% of the responses as trans spectrum, and that included students who identified as trans man or trans woman, and then where there was an alignment with sex at birth and a difference in current gender identity. And then we had intersect as well, and that was not included in the analyses. Next slide. So these are results from items from the campus climate section of the survey. It can give you an idea of the differences between the two categories that were created here, heterosexual, straight, and queer spectrum. And there'll be a noticeable pattern here with all the results we look at. For this particular item, students are asked to rate how the feelings of respect based on certain attributes of the student. And this one's sexual orientation. And here you can see nearly a 30% difference between feelings of respect, strongly agree with that statement for the heterosexual straight students versus queer spectrum. Next slide. And same question under gender identity, but with respect to their gender. Cisgender students, almost 2/3 agree or strongly agree with that versus only 30% for trans spectrum. There's definitely some male-female differences within the cisgender when you break that out, and that's particularly among females, it's lower than males, so that percent is lower. Next slide. These are a selection of items from the campus climate section again, and feelings of satisfaction and agreement about their security and safety on campus, and whether it's a welcoming campus. Would you still come here if you had a chance to do it again? Do you feel valued as an individual, and a sense of belonging? And again, the patterns are fairly similar here for heterosexual straight compared to queer spectrum peers, where heterosexual straight students tend to agree more strongly with these statements. Particularly among safety, there's a fairly large discrepancy, and as the campus is welcoming. But when you start looking at would you come back here, or some of the other overall satisfaction retention items, queer spectrum students are fairly similar in their responses to heterosexual straight students. They're showing some resiliencies there, and it shows up in some of the various outcomes that we look at as well. Maybe that's an artifact of being a large research universities, but overall, both groups don't agree as strongly with the sense that they feel valued as an individual. These are some very large campuses. And then do you feel a sense of belonging? Again, some differences there as well. Next slide, please. So this is the same set of questions for the gender identity group. cisgender compared to trans spectrum students. Some of these discrepancies here are much larger, particularly among safe and secure, so the environment on campuses. Again, the welcoming aspect of that. Again, a little closer on would you come back here again, but the differences are much more stronger here, with cisgender students responding much more favorably to that question than trans spectrum. Again, the sense of being valued as an individual is lower amongst the two groups as well, but still differences, and the sense of belonging, which we found to be a very important factor in student satisfaction and retention and other outcomes. So this is of importance that these groups are feeling different on these items. Next slide. For this, I wanted to look at some of the intersections of the different marginalized communities. And on the survey, we asked students to select whether or not they have a disability, and we asked about physical disabilities, learning disabilities, and psychological disabilities. And if they check nothing, then that would indicate no disability. So it's a select all that apply, and what you're looking at here is the percent of responses, not individuals. And so you can see here that of all the possible responses, 79% of the students said no, they didn't have any of those three. But 12% of the students indicated a yes response to psychological disabilities. And then next, learning disabilities at 6.4%. When you start disaggregating this out by the queer spectrum categories, there's some stark differences here. And here in this slide, I've collapsed learning disability and physical disability into other and separated the psychological disability, anyone who reported that. And you see almost a three times queer spectrum students more likely to indicate that as compared to the heterosexual straight students. Next slide. This is the same process, but for gender identity. And again, here it's almost a 5 times difference between trans spectrum and cisgender on reporting a psychological disability. So I think these are the kinds of findings that would indicate that for student support services, the types of groups that we might be looking at and where resources might be needed. And when you start looking at outcomes related to these categories, it becomes very apparent that there are significant differences. Next slide. This is just some sections here to show, academic engagement and disengagement for the two groups. And I put this out here to show that in terms of active learning and bringing up ideas or concepts for different classes, queer spectrum students are more likely to indicate that they do that very often or somewhat often as compared to heterosexual straight students. In terms of disengagement, they tend to be a little higher on some things in terms of going to class unprepared or skipping classes. But when you look at GPAs, you see very little difference in the two groups. And the next slide is the same items for gender identity. And again, you see a similar pattern where trans spectrum students are reporting more often that they're contributing to class discussions or bringing up ideas or concepts from different courses during class discussions. And again, a similar pattern with disengagement, going to class unprepared more likely or frequently skipping classes. But again, very similar GPA outcomes. That's what I have for some results.
Thanks, Ron. Back to me. This is Mary Hoban again. Let me jump right into some of the information I want to share with you. Folks have mentioned we're looking at, as we collect this data on numerous campuses, the individual number of students that are trans spectrum or queer spectrum may be relatively small on each of these campuses, but the power and the beauty of doing what we're doing with these aggregate data sets is that we do get a large enough number of folks to really take a look at and learn from, draw some conclusions that we might not be able to do at the campus level. This is the data from the 2016 National College Health Assessment. You see we have just over 9,000 students that are in this umbrella of queer spectrum. And if you note here, bisexual and pansexual students together really make up more than half of the queer spectrum category. Taking a look at some of the findings, and let me explain first about how I've set this up. For each question, I've presented the queer spectrum. The first middle two columns there are queer spectrum versus our straight students, and then the last two columns are trans spectrum compared with cisgender students. And I should say cisgender is my term. We don't ask about cisgender on the survey. I do get that feedback a lot, mostly from trans spectrum students. And until cisgender people recognize themselves as cisgender, I don't imagine we'll be able to measure in exactly that way. But for sake of argument and shorthand here, these are the students that identify as female or male once we take a look at their responses to the three questions that I mentioned earlier. So the first three questions we're looking at here is alcohol use, marijuana use, and tobacco use within the last 30 days. And that tobacco use is a pretty broad category. It includes cigarettes, e-cigarettes, water pipe, smokeless tobacco, cigars and little cigars, and clove cigarettes. And you can see here that in each case, with only one exception, the queer and trans students report higher rates of use in these substances in the last 30 days, with the exception of alcohol use and trans students. The cisgendered students actually report slightly higher rates of alcohol use within the last 30 days. But that's really the one exception here. When you look at tobacco and marijuana, those rates are actually 50% more for the queer students. Looking at just those two particular questions, the differences are not quite as great for the trans and cisgendered students, but that pattern remains the same. Oops, I'm not, oh shoot. Let me switch to my presentation mode and show you this part here. And if one of my co-presenters will let me know if there's anything funky going on with the presentation. The next two categories I looked at ecstasy and other club drug use, as well as meth use. And you can see these numbers are very, very small. We don't have a lot of use of these substances on campus. I don't want to overstate the problem, but what is a concern is the disproportionate figures we're seeing here when we start comparing the queer spectrum students to straight students and trans spectrum to the cisgender students. They're twice as high or almost twice as high in each of these categories. The other thing that we're talking a lot about in public health is, of course, the opioid crisis that we're facing in this country. And again, I don't want to overstate the problem on campus. We are seeing really relatively small numbers in these categories. We don't have a lot of heroin users on campus. However, when we look at the patterns between groups, they are very, very different and of concern. We know that prescription drug misuse is, or prescription drug for an opioid pain reliever is often the gateway into an opioid addiction. And we do ask students whether or not they've used in the last 12 months a pain medication that wasn't prescribed for them. And you can see the differences, almost 5% of straight students, but closer to 8% of queer spectrum students. Same thing, cisgender and trans spectrum are noticing the same pattern. Of particular concern for overdose are those students that might mix an opioid with a sedative. And I did, again, very small numbers, but I did take a look within our data. 1.6% of the straight students compared to 3.2% of the students on the queer spectrum, and similar differences with the trans spectrum and cisgender, that considerably more students may be mixing those substances. For mental health items, take a look here first at the queer spectrum versus straight students. You can see the clearly differences in feeling very lonely or so depressed it was difficult to function in the last 12 months. But really the starkest differences are in the last 3 rows there on self-injury, suicide ideation, and suicide attempts. And looking at those differences, you can see they're really almost 3 times as high for the queer spectrum students. And you'll notice a similar pattern with the trans spectrum students, that those rates are 3 times the same for their straight peers or their cisgender peers. One thing I'd point out about this is that we don't have data on suicide, where a completed suicide. What we are able to ask is after the fact whether there was an unsuccessful suicide attempt. They have to be have survived the suicide attempt to be able to answer the question on the survey. So we're not a good resource for getting information about completed suicides. I do sometimes hear people trying to talk about our data in that way, and I don't have that. Academic impediments. If you look, you'll notice that stress and anxiety is common for really all students, but we see higher rates in queer spectrum students, both stress and anxiety. And you look at rates of financial problems or roommate difficulties, they're almost twice as high for our queer spectrum students. Depression interfering with their academic performance is twice as high. Drug use, we looked at those differences in use just a few minutes ago, but you can see more than twice as many students report drug use impacting their academic performance. 2.5 times more queer students report eating disorders impacting their academic performance. And really the highest difference here is under discrimination, where that difference is 4 times for queer spectrum students. Similar pattern for the trans spectrum. The anxiety and stress are higher, but not exponentially higher in the same way. Roommate difficulties and financial problems are almost twice as high. Drug use twice as high as their cisgender peers. Depression interfering with academic performance is more than twice as high. We see 3 times the number the eating disorders reported that are impacting their academic performance, and the discrimination is actually 6 times as high in impacting that academic performance. This slide looks at sexual and relationship violence. In the top part here, we're looking at 3 measures of sexual violence, whether they were sexually touched without their consent, sexually penetrated, sexual penetration was attempted without consent, or sexually penetration occurred without consent. And these are all within the last 12 months. Now you can't add these categories are not mutually exclusive, so you can't add them together to get the total number of students impacted or experiencing these items. So if that's what this 4th row is here of figures, those are students that report 1 or more of the victimization types above. And you can see here that our queer spectrum students report twice as often that they have experienced in the last 12 months some kind of sexual assault, particularly when you look at the penetration, sexual penetration without consent is more than twice as many. Trans students, we see the same thing, almost twice as much, but not quite twice the number of sexual violence cases. But again, at penetration without consent, absolutely, those figures are double for our trans students. And the bottom part of this slide is looking at abusive relationships. And you'll see spread out there individually an emotionally abusive relationship, physically abusive, or sexually abusive relationship. And again, the same columns, queer spectrum, straight, and then trans spectrum and cisgender. And I did the same thing here. That last row is actually a combination of students that report any kind of abusive relationship, recognizing that they're not mutually exclusive categories. And again, you can see that the rates between queer spectrum and trans spectrum students and their peers are nearly twice as high. And again, that biggest difference is in sexually abusive relationships that are really more than double for our queer spectrum students and trans spectrum students compared to their peers. It's not on the slide, but I also looked at whether or not they were reported being a victim of stalking in the last 12 months. And that's one, again, for both queer spectrum and trans spectrum students, almost twice as high as their straight and cisgender peers. And we are ready to move on, and it's good timing to wrap up. Sue, I think you're up next.
Yes, thank you very much. And just to reiterate the findings from these studies, and we find that our own climate work is that in all of our work, 30% of the students have seriously considered leaving their institution. And the number one reason for departure that Ron alluded to in his work was that students don't feel like they belong on that campus. So if you do exit interviews and you use resources to do that, then I would suggest you may want to remove doing that, because they tell you it's finances in that particular case. And the next slide is a study by Lou and Miss Dancy, was done on LGBTQ students. Didn't include trans, but what they talk about is that if a student experiences any kind of victimization, and many of that's been spoken about within all four of the different organizational survey responses for queer students, that they experience that victimization, and I'm not talking about being slapped, but the microaggressions that the students tell us that they experience, being the last one picked, not having a place to go to find support, etc. If they lack that social support, they start feeling hopeless. If they feel hopeless, they tend to leave. And as Mary pointed out, it's higher among our trans and queer spectrum students. But students don't just leave in that most egregious way. They also leave maybe a student organization, or they might leave an athletic team, or they might leave the institution, or unfortunately might leave altogether. So there is research outside of the work we're doing in this project to support some of the things that my colleagues have talked about.
All right, so this is Maren again. And so after looking at all of the findings that we saw across all of these surveys over and over again, we clearly have some pretty serious mental health issues on college campuses amongst queer spectrum and trans spectrum students. And, knowing that is part of how we address it, but I think campuses really need to sort of step up and start looking at their policies and procedures and how they can create an affirming environment for these students and mitigate some of the risk factors that we've discussed today. And so a big part of that is increasing support and outreach programs for queer spectrum and trans spectrum students, ideally through staffed LGBTQ plus resource providers. But at smaller schools, the development of faculty and staff mentoring programs, a counseling center that runs an LGBT peer mentor program, student organizations. There are a number of ways to organize support for these populations without needing to advocate for, professional staff and professional space. But that's the ideal. Mary, slide. And so when we look at what best practices are, a resource that I do want to share with you is the Campus Climate Index, which is a tool that was developed by Campus Pride in partnership with a couple of folks on this call. And what that index does is it provides sort of a benchmarking inventory list that you can use to assess where your climate and campus resources and programs available to queer spectrum and trans spectrum students are and where they need to go. And so when you look at LGBT resource provisions, it is something that is represented at roughly 15% of colleges and universities in the United States. And, when I say, sort of the presence of an LGBTQ professional staff member, that includes either one 20-hour-a-week graduate assistant or one employee who's half-time, for whom half of their responsibilities are dedicated completely to LGBT issues. So when only 15% of institutions have this, and these students are dealing with the issues that they're dealing with that we discussed today, that's very, very concerning. And the reason why LGBT resource providers, I was one for 10 years, the reason why they're so important is that they're a trusted, first point of entry for students to get help, to get support in whatever way, shape, or form they need to. These resource providers know where to send students on campus and can sort of, refer, a student in sort of a warm handoff, as opposed to sending a student cold into a financial aid office or a counseling center, and really sort of create a wraparound support network for students. But these professionals also do training with faculty and staff so that the entire campus can be a safe space and students are not just necessarily sort of bound by one office that can support their needs. And these centers engage students in leadership development and moral and ethical development in the ways that all students should have access, and provide students with some of the social emotional training needed to really thrive, support each other, identify when issues occur amongst their peers. I will say students have never told me what's wrong. I hear it from a friend of theirs who's concerned. And so the more we can develop peer mentor and peer education networks, the more we can sort of create an additional layer of support for these students. But lastly, having a physical space is really important. Students need to be able to see a space that they can go to, not just, some safe zone sticker on somebody's door, because that's not a convening hub. That is one place for a student to get support, but research shows us time after time that students are more influenced by their peers than they are by us. So if you can, sort of collect a critical mass of students who are reinforcing positive behaviors, you can really create an affirming environment for these students on your campuses. And, just generally, I think we all have a responsibility to be developing LGBTQ resources, whether or not we do or do not have professional staff on our campus who are responsible for these things. And I've worked with some wonderful institutions creating partnerships with counseling centers and health services and housing on gender neutral housing issues or peer mentoring programs, or HIV testing or whatever it might be. And when you partner, it creates sort of this wonderful way to connect students to resources in a way that they trust, because, their professional staff people have vetted and vouched for the individuals they'll come in contact with. And I don't know if you can see it on this screen, because for some reason we're having some issues putting the slideshow on, but this is something very dear to my heart. I have watched students be burdened with the responsibility to serve their own needs, serve the needs of their peers, educate their faculty and staff, and that is not something that they should be, saddled with having to do while, going to college and trying to support, their friends and family. And so it is really up to us as the professionals to try and find ways that we can create and hold space for these students in an ongoing way. And I think that's what I have to say with regard to this. But I wanted to hand it over to Mary to talk about the ACHA guidelines that we wanted to highlight.
Yeah, I just want to mention that we have put together these guidelines for developing trans-inclusive college health programs. Some of you may have participated in a survey we did over the summer to ask our members how they're doing on some of these different issues. And I'd encourage you to watch for a report early next year of those findings. So we're trying to quantify how we're doing in this area that I suspect will also shape sort of maybe the next iteration of these guidelines. I recognize that we have gone over. I appreciate you guys hanging in there with us. I apologize for the technical difficulties with the slides. I know they were a little difficult to read. We will have them available for you with the recording. So have no fear, we'll see that. I didn't see any questions posed to the speakers as we've been talking. If you do have questions, I'd encourage you to, you can either email myself, that's mhoban@acha.org, or you can email ACHA webinars at acha.org. That's been all over your materials as you registered for the webinar. So, and we'll try to route your questions if you have them to the right person to get you the answer. I thank my co-presenters today. Again, this has been a really wonderful project to work with. These folks are smart researchers that really care so much about students, and I get inspired every time I work with them, and I hope that you guys did as well. So thanks for your time today.